Today we are talking about ESR or Erythrocyte Sedimentation Rate. As you know, ESR is a simple, indirect, non-specific test for evaluating the presence of inflammation. Of course, as you know, ESR means that how the blood cells are settled at the bottom of a vertical tube in 1 hour, and then the distance or the result is reported as millimeter per hour. During inflammatory processes, which is very common, the inflammatory proteins reduce the normal repulsion between red cells. Okay, so the cells form stacks called rouleaux, as you see here, like cone over each other, become heavier as a group and settle faster. So we expect that during inflammatory process, the ESR is increased. Also today, other inflammatory proteins such as C-reactive proteins are also used with more benefits in comparison with ESR, but in many places still ESR is used regarding to its simplicity and the cost of doing it. So collect anticoagulated venous blood, mixed, set upright in a Westergren tube, wait 60 minutes, and then read this distance, from above until here, and we reported it in millimeter per hour, for example 10, 20, 50, etc. New methods such as Westmatic automated ESR or micro ESR, the latter is very useful for infants because they need only a very small blood volume, or also today's are little by little replace the old manual Westergren that used for many years in numerous laboratories. Normal adult ESR reference values based on sex for men below 15 is less than 50 millimeter per hour, and for women under 50 is less than 20 millimeter per hour. Between 15 until 85 years of age for men is under 20, and for women is under 30, and above 85 years of age for men is under 30, and for women is under 42. So be careful when you see the sheet of a ESR. First of all, note to the age of the patient. Of course, many physiologic or patient factors such as age, sex, pregnancy, concomitant anemia, obesity, occult kidney disease, or plasma proteins increase can change the results, or the nature of the red blood cells. For example, if the patient has sickle cell disease, may change the answer, or some technical factors such as tube not vertical or wrong dilution, and etc. can change the ESR result. I show you here the other factors such as temperature, timing, delay testing, position of the tube, and sample quality. But what I want to emphasize is that the clinical interpretation and the clinical importance of ESR is very important, because when the patient ESR is under 20, it's normal. Between 20 to 40, it's mild increase. Between 40 to 100, it means moderate increase in ESR has occurred. And after 100 up to 150, it means we have a marked ESR increasing. So ESR can help us to detect inflammation, can help us to follow disease activity over time, can help us to monitor response to therapy in selected disease, and of course can support suspicion of conditions such as temporal arteritis, polymyalgia rheumatica, rheumatoid arthritis, osteomyelitis, and even some malignancies. So what is very important for me is that, first of all, you should think about a baseline ESR, then the trend and the following reveal that is it get rise or it fall over, or under treatment. If it is fall, it means the response treatment is very good, and if it is unfortunately still high or increased, means the treatment doesn't work well. And sometimes months or years after complete treatment, the increased ESR supports suspicious of flare-up or recurrence of the disease. Here I want to show disease-specific notes about ESR. For example, sickle cell disease. You know, in many areas of the world, sickle cell disease is very common. And as you know, sickle cell disease may be quiet or or maybe have crisis. During quiet phase, ESR may be low, but it may rise sometimes before or around painful cramps, painful abdominal crisis, painful bone marrow crisis, ESR gets rise. Or when a patient has osteomyelitis, elevated ESR can support suspicion the presence of osteomyelitis, and it's very useful for follow-up. During a stroke, higher ESR is associated with worse prognosis. If a patient has prostatic cancer, I mean adenocarcinoma of prostate, if it is very high, for example, more than 100, it means that now the patient has an advanced disease with a poor prognosis and more probably with metastasis. In coronary artery diseases also, elevated ESR reflects inflammatory risk prognostic information. An interesting thing is about ESR during pregnancy. At the week 10 to 12, ESR gradually is increased, and ESR is high until 1 month postpartum. So when a pregnant woman is your patient, be careful that ESR is normally increased during pregnancy. But when we are talking about marked elevation, I mean more than 100 millimeter per hour, very bad neoplasm such as multiple myeloma, macroglobulinemia Waldenstrom, severe hyperglobulinemia, severe inflammatory disease, and hyperfibrinogenemia should be considered. Moderate elevation between 50 to 100 are seen in rheumatoid arthritis, chronic infection, for example, chronic pyelonephritis, or a chronic pelvic infection, collagen vascular disease such as lupus, paroxysmal systemic sclerosis, and in some neoplastic disease, we'll have a moderate elevation of ESR. Another interesting and life-saving importance of ESR is when the patient has temporal arthritis. In temporal arthritis, marked increase in ESR means that you don't have enough time to begin steroid therapy. If you do not do steroid therapy, visual symptoms and unfortunately blindness may be occurred, and it is a very important clinical issue. In Hodgkin lymphoma, ESR is also used as a risk factor for follow-up of the patient before and after treatment. And finally, it is interesting that we know ESR in some investigations is gradually increased 1 year before the diagnosis of renal cell carcinoma. So you see that we can use ESR as a non-specific but very useful marker for especially following up of variable diseases. Thank you very much.